Hi, my name's Toby Hammond. I'm a consultant surgeon and I have a specialist practice in groin and abdominal wall hernias, as well as certain bowel-related conditions. So following the operation, it is going to be a bit sore, and that is to be expected, and you should be able to manage that with simple painkillers such as paracetamol and ibuprofen. You may also find that you get some slight bruising and swelling around the site of the operation, particularly if it's been an open operation. That's nothing to be concerned about. It's quite usual, particularly if the hernia is very large or it's been there for a very long time. However, if you get rapid swelling and rapid bruising, do contact the hospital because there may be a problem. You may also find that you've got an area of numbness or tingling at the site of surgery. That should return. Occasionally that numbness can be permanent, but it's generally only a very small patch. And again, that's more relevant to the open operation than the keyhole operation. In terms of the wounds themselves, there are different ways that the wounds can be closed. So the way I close the wound is I use an absorbable suture. So that means it will dissolve, it doesn't need to come out, and we'll cover the incision with a waterproof glue so that you can bath or shower straight afterwards. However, if your surgeon hasn't used a waterproof glue, then you may need to keep the area dry for around 48 hours after the operation. In terms of what you can and can't do following the operation, my general advice is you can do whatever you want following the operation. There's very little that you can do that's going to undo the operation. I think patients are worried about lifting and carrying, and they may be given different advice depending on who's done the operation and where they've had it done. But generally speaking, let pain be your guide. You can do whatever you want to do. So if you want to do the gardening, you want to climb the stairs, you want to make love, you want to play sport or activity, that's fine, as long as when you're doing it, it's not causing too much pain. And if you are experiencing significant pain, then just be sensible, listen to your body and ease off. So I guess the general advice is do whatever you feel able to do, let pain be your guide, and if it starts hurting, be sensible and stop doing it. In terms of driving, my general advice is give it a couple of days from the operation and then sit in your parked car, practice doing an emergency stop, put on your seatbelt, twist to check your blind spots. If you can do all the normal activities that you need to do when you're driving a car and that's not causing you pain, then you are safe to drive. The one thing I would strongly recommend though is please contact your insurance company before you drive, because they may have different stipulations. In terms of going back to work, again, it's very variable. People return to work at different times. Most people are back to work within a couple of weeks of the operation. There's no hard and fast rules. Again, it's about letting pain be your guide, be sensible, and do what you feel that you can do. Clearly, if you've got a very manual job involving a lot of heavy labour, that's going to be very different to someone who potentially works from a desk. If you think you've got a hernia, please go and see your local GP. They will assess you, and if appropriate, they will refer you on to see a surgeon such as myself. If you want more information about hernias in general, I strongly recommend you go to the British Hernia Society website. They've got loads of information there for patients about different types of hernias and different treatment options. There's also the European Hernia Society website, which actually has a section called Guidelines, and it talks about all different types of hernias with all the international and national guidelines for how to treat different types of hernias.